Hello everyone, here I'll discuss about the anatomy of external layer. This is a figure of this right here. The externally, you can see this is the auricle of the pinna which leads into this external acoustic meatus. The medially, you can see this is the tympanic membrane of this eardrum. Here medial to this tympanic membrane, you can see this ear ossicles, the part of this middle ear. Then medialmost, you can see this is a semicircular canals with the cochlea which forms here, that is the internal layer. So ear gets divided into external layer, middle ear and the internal layer. We'll see the features of this external layer which includes this auricle and this one here, this is the external acoustic meatus, and also this tympanic membrane which separates this external layer from this middle layer. Here this is the right auricle of the pinna. This is the lateral surface. Here the surface behind the lateral surface, that is the medial surface of the auricle. The lower part, this is soft and it's the lobule of the auricle. Here it's made up of this adipose tissue and this loose areolar tissue. Here the remaining part is hard and it's made up of a single framework of yellow elastic cartilage. Then outside the cartilage there you can see the perichondrium. Then the perichondrium is lined with skin. So the skin over this lateral surface is adherent and the skin which lines this medial surface is loosely attached. Here you can see there are the elevations and these depressions there in this lateral surface. Here the outer here, this elevation, this is the helix. Here this is the helix. Medially here it forms, this is the crus of the helix. So here in this opposite to the helix, this area, this is the antihelix. Here it forms two crura. Here the depression between these two crura, this is the triangular fossa. The depression between the lower crura of this antihelix and the crus of the helix here, this is the cymba conge, which leads to this, which corresponds to the suprameatal triangle, and also it is an important landmark used in this mastoid surgery to reach the mastoid aneurysm. Here the cartilage is deficient. Here the medially, here this is the foramen here, this is the external auditory meatus. Depression here, this is the concha which leads into this external auditory meatus. The elevation here, this is the tragus. Opposite the tragus, this elevation, this is the antitragus. The notch between these two, that is the intertrachic notch. This is some important features of this auricle which leads into this external auditory meatus. Here you can see here this is the auditory canal. So it consists of two parts, the outer 1/3, that is the cartilaginous part, and the inner 2/3, this part here, this is the bony part of this canal. So this part is the cartilaginous part of the canal and this one, that is the bony part of the canal. Then medially you can see here, medially this is the tympanic membrane there. So the length of this auditory canal, that is 24 millimeters. The cartilaginous part length is 8 mm. The length of this bony part, that is 16 mm. The direction of the canal, that is in the cartilaginous part, that is cartilaginous part of the canal direction, that is the upwards, backwards, then medially. Then direction of this bony part of the canal, that is downwards, forwards, then towards medially. It is not straight. Then here the cartilaginous part of the canal, the cartilage is the continuation of the cartilage of the auricle, and the skin over this cartilaginous part of the canal is thick. There you can see the sebaceous gland and ceruminous glands which secrete the wax, and also hair follicles there. So this area is more prone to infection. The skin over this bony part, that is thin. Here there is this is the medial tympanic membrane which separates this external layer from this middle layer. Here this is the canal. This is the cartilaginous part of the canal. This one is the bony part of the canal. So some 6 millimeter lateral to this tympanic membrane. The canal is narrow. That's called the isthmus. So if any foreign material gets lodged in the part of the canal, medial to the isthmus or lateral to the tympanic membrane are difficult to remove, which can cause perforations or infections to this tympanic membrane. Okay. Then coming to this antero-inferior of this canal, see here at the antero-inferior of the cartilaginous part of the canal, there you can see some gaps, these deficiencies. These are called the fissures of Santorini. In the bony part of the canal, there sometimes there is a non-union of this bony components, forms a foramen that is called the foramen of Huske. That is called the foramen of Huske. So if this foramen usually gets fused after the age of 5, in some people it persists. In those people there can be the spread of infection from the parotid gland lower and this infratemporal fossa towards this canal, auditory canal, and also from here the infections also spread to this parotid gland and towards this infratemporal fossa also. Okay. Here antero-inferior of the cartilaginous part, there is the fissures of Santorini, and the antero-inferior of the bony part, there is the foramen of Huske. Through this fissure and foramen, infections can spread from the parotid and from the infratemporal fossa towards the canal and vice versa. Then here comes the tympanic membrane. Here you can see the tympanic membrane which separates this external layer from the middle layer. See, this is the lateral surface of the tympanic membrane. See, it is oval in shape. See, the tympanic membrane is oval. This is the lateral surface is concave, which is directing towards this external auditory meatus and is directing downwards. See, it's downwards, forwards and laterally. Then this medial surface here, this is the medial surface, this is convex. Here we can see the attachment of this handle. This is the malleus bone. Here the handle of the malleus is attached to this medial surface. There also in the handle there one muscle attached, that is the tensor tympani, which pulls the tympanic membrane towards the medial surface, towards the middle ear. That's why here this medial surface is convex, here it is concave. See here, this is the structure of this tympanic membrane. See, this is oval. It is trilaminar. See, it is trilaminar. Then the diameter is 8 to 10 mm and its thickness is 0.1 mm. Okay. Here, this is the right tympanic membrane. Here you can see middle, here this is the handle of this malleus. In this medial surface, there is can see a maximum convexity that forms the umbo that you can see over this medial surface. This is the lateral view. Here, the outer, this is the fibrocartilaginous rim. Here, this membrane forms a fibrocartilaginous rim that is called the annulus tympanicus. Here, that is the annulus tympanicus. Then here this one, in the upper there are two notches there in this rim. There can see the attachment of anterior and posterior malleolar folds there, which is these mucosal folds are due to this lateral process of this malleus. This is the handle of the malleus. So this entire part of the tympanic membrane here, this is called the pars tensa. So that is the pars tensa. The part of the tympanic membrane between these two malleolar folds, this is the pars flaccida. Okay. Then coming to the structure of the tympanic membrane, from outer to inner, the outer that is lined with the stratified squamous keratinoid epithelium that forms the cuticular layer. The inner part that is fibrous, that consists of this radiating fibers, outer radiating fibers, and there is the inner circular fibers. The circular fibers are more numerous in this periphery. This forms the fibrous layer, and also innermost layer that is the mucosal layer. It is made up of simple columnar epithelia. Okay. So these three structures you can see in this pars densa. In the pars flaccida, this is thin. The fibrous layer is replaced by there is a loose connective tissue, okay, and appears as pink in color. So this color of this tympanic membrane, that is gray color, pearly gray color. The pars flaccida here, that is thin and appears as pink in color. The fibrous layer is replaced by that is a loose areolar tissue. Then here there is an imaginary line through this tympanic membrane to the handle of the malleus goes vertically. Here there is a vertical line, and also to this right angle of this vertical line through the umbo, which divides this tympanic membrane into four quadrants. This is the andro-superior quadrant here. This one is the andro-inferior quadrant. This is the postero-superior, and this one is the postero-inferior quadrant. In the andro-inferior quadrant, you can see this cone of light here. That is, during the inspection of this tympanic external ear to examine this tympanic membrane and this one middle ear through this otoscope. So the light falls on the tympanic membrane, causes a cone-shaped reflection here. This is the cone-shaped reflection of light which appears on this andro-inferior quadrant, that is the cone of light here, which reflects a normal tympanic membrane. Okay. So these are the features of this tympanic membrane. Here also you can see here in this figure, see this is the external auditory canal. See here, this is the tympanic membrane. See, this is the lateral surface, that is concave. See here, this is the medial surface just towards this middle ear. This is convex, and the maximum convexity here, this part, this part here, this is the umbo. Here you can see the attachment of this handle of this malleus. This is the head of the malleus. This is the, you can see this is the handle of the malleus. You can see this is the process, lateral process of this malleus. Then here you'll get one muscle, that is the attachment of the tensor tympani, which pulls the tympanic membrane towards this middle ear. Yes, that's about the features of this tympanic membrane. Here comes the blood supply. Here the tympanic membrane's blood supply to this lateral surface. There you can see this is the, here this is a deep auricular artery which supplies over this lateral surface. It is a branch of this maxillary artery. In this medial surface, this is the medial surface. Actually here it's also looking like a lateral surface, but it's a medial surface blood supply that is from this anterior and posterior tympanic. Anterior here you can see this is the anterior tympanic artery, that is a branch from this maxillary artery. Then here you can see this is the posterior tympanic artery. This posterior tympanic artery is a branch from the stylomastoid artery, that is a branch of this posterior auricular artery. So that's the blood supply. Here this venous drainage here, that is towards the inner from the inner surface, that is toward the transverse sinus of this cranial cavity, you can see. Then external surface, outer surface, that is to the external jugular vein. Then nerve supply, the tympanic membrane is very pain sensitive. Then so this nerve supply here in the lateral surface, there is the auricular branch of vagus now, auricular branch of this vagus. Then there is through the auriculotemporal now, auriculotemporal, this is a branch from this mandibular now. Then the inner surface nerve supply, that is through this tympanic branch of this glossopharyngeal nerve. Okay, so that's about this nerve supply, blood supply. Then here you can see this is the here. So this here you can see this the external layer, you can see this is the middle ear. Here we'll get this is the tympanic membrane or this eardrum. So perforations of this tympanic membrane or the and the infections can occur due to an external injury or infection from this middle ear, which can cause perforations to this tympanic membrane, which leads to this otitis media. Okay, here there is some upper respiratory tract infections which can cause this pharyngotympanic tube or this eustachian tube, which connects this middle ear to this nasopharynx, gets blocked, so that accumulation of pus there, fluid accumulates, which can cause this bulging of this tympanic membrane to the exterior, which can leads to this perforations. And also here, if any external injury also can cause perforations, which leads to a condition that is called the otitis media, which requires medical treatment. Here, that's about the features of this external layer. So external layer, which includes the spina or the auricle. Here you can see the depressions and this elevations of the lateral surface. Behind that is the medial surface of this auricle, which leads into this auditory canal. Auditory canal has a cartilaginous part outer and the inner bony part. The directions of the canal and its clinical importance. Then you can see this is the tympanic membrane. There is a semi-transparent membrane which separates this external ear from this middle ear, and these features of this tympanic membrane. Then this blood supply, nerve supply, then clinical features of the tympanic membrane. So here it completes this external ear. That's all.